Thank you for joining us tonight. My name is Barry Erickson, and I am Community Engagement Coordinator at Wheaton Public Library. The ACES series stands for Aging and Caregiving Engagement and Support. And we designed this series in order to be a centralized source of information and resources for our seniors and caregivers. Tonight, we are proud to bring you this session on protection and advocacy. If you see something, say something. We will learn how to identify the signs of abuse and neglect and the services available to protect yourself or a loved one. Whether living independently or in a long-term care facility, the Adult Protective Services staff of DuPage County Senior Services is ready to advocate for you. The Long-Term Care Ombudsman Program protects and promotes the rights and quality of life for residents in long-term care facilities. Lindsey has been with DuPage County Senior Services for 10 years and with the Ombudsman's Program for the past 7 years. Regina Scarpace has been with DuPage County for 7 years and with Adult Protective Services for 5 years. So with so much great information to provide, I'm anxious to turn the screen over to the two of you. And I believe, Regina, you're up first.
Yes, thank you. Let me go ahead and share my screen with you guys. So yes, my name is Regina and I'm from Adult Protective Services. So I'm going to just jump right into our program. So with Adult Protective Services, we deal with our client base is the victim population. So in order to be eligible for our services, you must be either cognitively or physically disabled, 18 to 59 years old, or 60 years and older, just based on age. The alleged abuse, neglect, or exploitation must have occurred within the past 12 months. The victim must reside in a domestic setting. We don't typically go into nursing facilities unless recently we've been able to, if it's a financial exploitation case. And then also good to know is that we do have translation services available for non-English speaking victims. The types of abuse that we investigate: financial exploitation, emotional abuse, passive neglect and willful deprivation, confinement, physical abuse, sexual abuse, and self-neglect. And I will go ahead and get into a definition and some examples of those in just a minute. So just putting this all into perspective, nationally, 1 in 8 US adults aged 35 to 64 has a disability, and 1/3 of adults aged 65 and older has a disability. To compound that, via the Bureau of Justice Statistics in 2016 did a study, and they found that the victimization rate of persons with disabilities is 2.5 times higher the rate of people without. The perpetrators or the alleged abusers that's what we label them per our program standards. They're often not strangers, but rather caregivers or someone else who is close to the senior or the person with the disability. And also, we do believe that around 1 in 5 cases of abuse are not reported to authorities. And just a little statistics, the main thing I want you to get out of this pie graph is that by and large, most of our reports come in through another professional or advocate. Self-reporters or family members, they only make up around 20% of the reports that we have received. With the age of victims, we have under 20%, 18%, 18 to 59 of the reports that we've received. And this is through 2019 Adult Protective Services in Illinois. So this is just for our state. But also another thing I wanted to point out is our alleged victims, 1 in 5 is age 86 and older. And then also the race, you can see that there's a pretty large disparity that the Caucasian population is overrepresented. They make up a vast majority of our reports. And this might be a very confusing bar chart, but the first 3 categories, the purple, yellow, and green, are a relative, a spouse, a child, or another relative. And as you can see, if you lump those together, those make up most of our abusers And they, as you can see, they point down to based on the abuse type. The only one where the other, which would be a stranger or somebody maybe not related, where it would be higher, is in your cases of sexual abuse. As well as we do have some leading barriers with our victims. A lot of our victims have self-care difficulty bathing and dressing themselves. Over a third of them also lived with their abusers, and they have independent living difficulties. They may need help managing finances, doing the grocery shopping, housekeeping, and laundry. And this is the number of cases received by Illinois in last year in 2020. This has followed the trends for the past quite a few years, where financial exploitation and emotional abuse are the two most reported abuse and neglect types. And then the two least reported are sexual abuse, then followed by confinement. And like I said, that usually follows our trends over the past several years. So getting into it, the first one is financial exploitation. So that is what we normally think about, stealing money or property. We don't have a minimum for theft. Again, even if it's $5, that could be considered financial exploitation. Another thing to remember with financial exploitation is this also includes damages to property. So breaking holes in the wall, and then also using somebody's game. This is common when we see with power of attorneys, where they're using their person's finances not to manage their own care, but for their own gain. Emotional abuse, or sometimes you'll see it referred to as mental abuse, that could include threats, humiliation, harassment, intimidation, threatening with abandoning the person, institutionalizing them, threatening to put them in a nursing facility. It could be considered, again, yelling, swearing, name calling. And emotional abuse, it's still abuse, even if the person may show no signs of being upset. Sometimes we have where they're so numbed by it that they don't outwardly show any upset with it. But if they meet that criteria, it could still be emotional abuse. Neglect, we actually have, it's two sides of the same coin. So we have passive neglect, and then we have willful deprivation. Passive neglect, as you may figure, is the failure of a caregiver to provide for the basic needs of the person, not including but not limited to food, clothing, shelter, health care. And willful deprivation is the intentional failure of a caregiver to provide for those basic needs, including, again, food, medicine, shelter, clothing, any of those needs, assistive devices, arranging home health services, those things. If it's intentional, it would be deprivation. If it's maybe because the person is physically unable to, they don't have the resources, but they're still in that caregiver role and responsible for that person, it would be considered passive neglect. And some more indicators of passive neglect, that would be leaving a dependent adult without a caregiver, without adequate supervision, as otherwise noted maybe by a physician. If somebody is bedbound and they're not able to respond to emergencies, leaving them without supervision, that could be considered neglect. Wandering, if a person's still driving, even though they have dementia and signs of confusion. It could also be the possible unsanitary or hazardous conditions in the home, such as hoarding, excessive clutter, infestations of bugs, inadequate food, no food or spoiled food, malnutrition as well, or clothing inappropriate for the weather, and failure to comply with any medical treatment plan. Those could all be indicators of passive neglect. Confinement, that is restraining, isolation, denying access to phone or mail, limiting time someone spends with loved ones, and controlling the social activities of another person. For isolation, it could also be, for example, taking someone's phone so that they don't have access to call, or making sure that the only way that another person can call or speak with them is to go through that caregiver or that family member, because Adult Protective Services sees that a person you have that right to privacy, you have a right to have private conversations. And so, again, limiting that time that could be seen as confinement. Physical abuse, that could be considered assault, hitting, pulling hair, but also over medication and grabbing or handling roughly. With physical abuse, there does not need to be visible marks or bruising to be considered physical abuse. In sexual abuse, it's any sexual activity with a person that's not able to give consent, any sexual act that's committed under the threat of harm, or any forced sexual act. With sexual abuse, we typically see these in the under 60 population. And then self-neglect. So that is a condition that is the result of a person's inability, either due to a physical or cognitive impairment or both, or because of a diminished capacity, that they're not able to perform essential self-care tasks, and it needs to substantially threaten his or her own health, which this includes providing essential food, clothing, shelter, and healthcare services. So for example, it would be not taking life-sustaining medications. Maybe, not taking a baby aspirin, that might not be considered self-neglect. But if you have someone that's diabetic and they're not taking their insulin or not following through with that appropriately, that could be considered self-neglect. That's also hoarding behaviors, people that are not feeding themselves, and also if they pose a danger to themselves with wandering or other dangerous behaviors. So what's the difference between self-neglect and passive neglect? The big difference is that with passive neglect, there is an identified caregiver, and self-neglect there is not. If you are ever in a situation where you need to call and make a report and you're not sure, you don't have to have that information. APS will determine that once the report has been made. So who should report suspected abuse? Anyone can report suspected abuse, neglect, or exploitation, but some people are mandated by law. Formal caregivers, social services staff, medical professionals, educators, law enforcement, including paramedics in the fire department. They are all mandated by law to report abuse, neglect, or exploitation. And what you would need in your report if you were ever in a situation where you felt like you needed to get Adult Protective Services involved. Well, what the allegations are, the potential to us as staff, because we are going out and doing home visits. So if there's any violence, drugs or alcohol, weapons, or dangerous animals in the home, any known concerns about the mental or physical condition of the alleged abuser or alleged victim, if someone's hard of hearing and wouldn't be able to hear the door if we were knocking, the best time to reach the alleged victim. I'm not going to really get into this, but we do have priority levels. Basically, the most serious priority for someone's at serious physical harm or immediate danger of death, we have to respond within 24 hours. And then the second one is where consequences are less than number one. And then our third report is a lot of our emotional abuse or financial exploitations. And we are still responding within 7 days. So after you make the report, DuPage County, we receive the report, we assign the priority, a caseworker gets assigned, and we call the reporter back. And we go and we make an unannounced home visit with the alleged victim, and we interview them, and our investigation begins. So just some good things to know about our program and our services. So our victims, we have the right to be safe, have the right to retain all of their civil rights, make decisions that other people, society may not think are great decisions, and choose whether or not to accept services and support. Well, what services can Adult Protective Services offer? So we can help with medical care, educating families on care needs. We're a liaison to accessing law enforcement, legal assistance with order protections, even sometimes helping family with needing to petition for guardianship, helping with the evictions process. We can also help with housing services and relocation services. We are mandated also to make police reports if a crime has occurred and our alleged victim is confused and not able to make that report themselves. Another thing that we do, excuse me, is we all many times refer to DuPage County Community Services. For the age 60 and over population, there's a community care program that offers in-home non-medical caregiving, home delivered meals for those homebound clients that are having problems with getting appropriate nutrition, referrals to financial assistance programs, the low income energy assistance program, housing information. We can also help with utilize some funds for home cleanup and minor home repairs. We also make referrals to counseling. And for the under 60 population, we also refer to Department of Human Services, either rehabilitation services or developmental disability services. And a lot of them have a lot of the services that I just mentioned for the over 60 population. And so here's who you can call. You can call during regular business hours, DuPage County Adult Protective Services, or we do have a 24-hour hotline. And I will go ahead and stop my screen and open it up for any questions.
Thank you so much, Regina. I don't see any questions in the Q&A at the moment, but I will just remind people that they can go ahead and click on that Q&A icon there and open that up if they have questions. Something that came up a couple of days ago, I was in a meeting with some community leaders, including some police officers and people from the sheriff's department. And they noted that since the pandemic, they've seen an increase in concerns about hoarding, unsafe home situations for people, self-neglect. Just wondering if you've seen some of that, if that's carried over into your department and other things that maybe you've seen, unfortunately, perhaps exacerbated by the pandemic.
Yeah, like with many, I think, other professional areas, we have seen an uptick in cases. At DuPage County alone, I think almost every month for a while, it's been a new record-breaking month. We do see a lot of, as the police officers are right, the self-neglecting behaviors, the hoarding behaviors, we are seeing that being exacerbated. And now that people are starting to receive, visitors and just get out more, now we're starting to get that reports more. Another thing that we are seeing a lot of is with the pandemic, there have been a lot of people that decided to either work from home or quit their jobs and become caregivers for their mom and dad or whoever, because, hey, that makes sense. We're in a pandemic, mom or dad needs help. I'll quit, move in and take care of them. And what we're finding now is that those people are not really, they were not prepared for the role of caregiving. They never realized what, the complex medical needs of caregiving for a person, what that entails. And so we're starting to see a lot more of that. And again, for the other side of it, for physical and emotional abuse, the more intentional abuse cases that we investigate, with the stress of the COVID pandemic and people just naturally being at home more and in close quarters, we're starting to see that rise. So it's coming from every angle. So just the COVID pandemic has really just exacerbated all of our social problems. And now we're starting to try to clean up that. The good news is, though, that there are more people are coming out and about. So they're having more contacts with supports. And therefore, people are making those reports so that we're able to help get involved and get services in place.
Right, great, thank you. And you sort of lead well just to mention that our next session in this ACES series is specifically for caregivers and services that are available to support them. So I'll just go ahead and plug that while we're talking about caregivers and the difficult job that is, and how easy it would be to desire to take that on, but not quite be ready for all of the different responsibilities that are involved. So I don't see any other questions at the moment, so we'll go ahead and move on with Lindsey's presentation, but please be sure if you have questions, go ahead and type those in the Q&A and we'll get to those in just a minute. But you can go ahead, Lindsey.
Thanks, Barry. Hi, everybody. My name is Lindsey Herza. I'm with the DuPage County Ombudsman Program. I'm going to go ahead and share my screen just like Regina here. Okay. So just want to go through a little bit about our program, but Barry, feel free to interrupt me if anybody has questions along the way. And let me move this. Okay, so what is a long-term care ombudsman? Kind of an odd word. It's a Swedish word meaning citizens representative. So our goal is to ensure that older persons or persons with disabilities receive quality services and a dignified life at the highest practical level. We focus mainly on advocacy services for residents of long-term care facilities, and I'll go over what types of facilities those are in just a moment. The program itself is resident directed, so we are taking direction, we are receiving permission from residents to help them. We're not going to do anything or talk to anyone without their permission or knowledge or direction. Just a little bit of boring history. The Ombudsman Program was mandated in the early 1970s through the National Older Americans Act, protecting the rights of nursing home residents or long-term care facility residents. And then the Illinois Act on Aging gives us the authority to advocate on behalf of the residents. So in Illinois, we have 17 regional ombudsman programs throughout the state. Most in the northern area, in our area, our regional programs are based on county. So we have DuPage County, and then Cook County is larger, so they have a couple of different ombudsman representatives. But downstate, an ombudsman program, a regional ombudsman program might be covering 3 or 4 counties, some even more than that if it's a very rural area where there aren't that many long-term care facilities. The program itself is grant funded through the Illinois Department on Aging and through DuPage County. So for our program, we have one regional ombudsman. Her name is Trish Niewohner. We have 6 case managers, 1 volunteer ombudsman coordinator, that's me. We have 11 volunteer ombudsmen, and then we do have 1 seasonal ombudsman intern that comes to help us out. So we are allowed 24-hour unrestricted access to enter any long-term care facility, which is great. Even though we don't want to enter in the middle of the night, we can if we need to. We are not an investigative authority, so if a formal investigation needs to be had, then we would notify either law enforcement or the Illinois Department of Public Health. We're not necessarily required to investigate anything and everything that's seen or heard unless the resident asks us to. We are exempt from HIPAA, and with the resident permission, we can access all of their records, whether they're medical, financial, etc. One thing that sets us apart from a lot of other programs and services is we are not mandated reporters. So again, if we see something or hear something, we cannot report it or do anything about it unless the resident gives us permission to do so. The only time that we are able to override that rule is if a resident is in physical danger, such as suicidal, self-harming, etc. I can go on about this for a long time, so I'm not going to get too deep into the weeds here, but these are the types of facilities that we cover. So the most common, you would hear of a nursing home. We refer that to a skilled nursing facility. They're going to be the highest level of care provided to their residents. So they're going to have 24-hour nursing care. CNAs, they're going to provide 3 meals a day. All medications and medical needs are covered. The resident has to be very dependent on the staff members to help them with their activities of daily living, like grooming, bathing, toileting, dressing, that kind of thing. A step above that is an intermediate care facility. Those are just a little bit more independent residents than in skilled nursing facilities, but they might have maybe a mental health need to be in a facility like that, but a little bit more independent. Assisted living facilities are a little bit different. They are housing residents that have minor needs. So they might have a need for assistance with 2 or 3 activities of daily living rather than everything. Assisted living facilities only accept private pay. So they do not accept Medicare or Medicaid for any of their services. It's extremely out of pocket. You'll see a lot of our fancier facilities are assisted livings. Supportive living facilities are even a step above that. The residents are very, very independent. They just might need assistance with having housekeeping once a week, having some of their meals prepared for them. Most supportive living facilities only offer lunch and dinner, and their residents are on their own for breakfast. They might need help with one activity of daily living. So for example, if they're a little bit unsteady on their feet and they're unsure about taking a shower by themselves, they might be able to ask a staff member to come and help them with that. But there are not 24-hour nurses. There are either nurses or staff members that are trained to remind residents to take their medications, but they're not dispensing it or administering any kind of medication. Our intermediate care facilities for developmentally disabled is exactly what it sounds like. Developmentally disabled adults would live in either smaller group homes, or they might have a home with, for example, there's one that I'm familiar with that has about 18 residents there. So the resident has to have a primary diagnosis of a developmental disability, and then any additional needs they would be able to have met that way. And a medically complex developmentally disabled facility, or an MCDD, these are more for a younger population that are of developmental disability, where they might be on vents or trachs 24 hours a day. They might have feeding tubes. They might be in a vegetative state. So the higher the need, they would be in the medically complex facility. So we have about 92 facilities in DuPage County. Keeps us very busy. So basically, we just inform residents of their rights and we advocate to protect those rights. I'll go through those a little bit in a minute. But we want to make sure that residents and facilities are aware of our program and our services, but we also provide community education sessions just like this one to inform the public about this program. We do a lot of in-service training for facility staff. We complete regular presence visits, or RPVs as we refer to them, where we are going into each of our facilities at least once a quarter, every couple of months, just to check in with the residents there, take a look around, make sure everything's okay, and ask residents if they have any concerns. We also attend resident or family council meetings. Council meetings meet monthly in skilled nursing facilities. So every once in a while, we will attend one of those just to kind of get a overall general feedback on how things are going. And then the Illinois Department of Public Health is the regulatory agency that they do these annual surveys where they come in once a year to kind of go through records and do a formal investigation on what's happening in these facilities. And they might have an interview with a small group of residents that are able to provide some good feedback. So sometimes they'll ask us to sit in on those as well and either provide feedback of our own or just kind of listen to see what the residents are saying. So residents don't lose any of their rights when they move into a facility. They actually gain rights under the Nursing Home Care Act. And I'm not going to go through all these, but the residents have the right to everything that they would have in the community, but they also have additional rights. So they still have the right to vote as long as they're in a facility, just as they would in the community. But they have additional rights where they can meet with the long-term care ombudsman, participate in the resident council meetings, and they have the right to present grievances and receive a prompt response from the facility staff, and of course remain free from threats, punishment, or retaliation for filing those grievances. A lot of the common problems that we see in long-term care, they might be abuse, neglect. Residents might have a lack of privacy, so maybe their personal care is not happening behind closed doors. They might have complaints about the food service. I mean, we can really investigate anything and everything that's going on that a resident may have concerns about. For example, my favorite one to use as an example, if a resident feels that the food quality is terrible and every day they cannot get a hot cup of coffee to save their lives, they just get cold coffee served to them all the time. It might seem like a small issue, but to that resident, if they can never ever get a cup of hot coffee, I know that would be aggravating for me. They might bring that complaint to management and nothing's done about it. So they might call us and be like, listen, I know this is not a big deal, but it's a big deal to me and my everyday. So we step in and help them with something like that. But again, we can also get involved if there's major abuse or neglect occurring as well. The types of complaints that we get come from a lot of different areas. So again, we're under the umbrella of the Illinois Department on Aging, and they have a hotline that anybody can call to file a complaint. We also have our main phone number at Senior Services at DuPage County. Our intake workers are trained to take reports as well. They can contact us directly, or sometimes if we're making a visit at a facility, the residents will stop us and talk to us and maybe share a complaint with us as well. We can receive them from any type of person, whether it's the residents themselves, their family members. Sometimes facility staff will call. They might not want to share their name, but they'll say, listen, I work at this facility and I see or heard something that's going on that I'm concerned about. I really think that it needs to be addressed. And any kind of social services, advocacy group, or hospital or medical personnel. So these are the types of complaints that we can get involved in. This is kind of a general list. But I wanted to make note that we do investigate financial exploitation, just as Adult Protective Services does, but we can only investigate financial exploitation if it's occurring by a staff member of a long-term care facility. So if it's happening from anyone else, then those kind of cases would go through Adult Protective Services. And we can make referrals to Adult Protective Services as long as we get permission from the resident to do that. We have priority timeframes as well. So if there's abuse or neglect occurring, if the resident is at risk for being transferred or discharged within 2 days, or if the facility is using restraints, then we would need to respond within the next business day. But normally our time frame is within 7 to 21 business days, depending on the severity of the complaint. So just to go through a few of these case examples here, if a resident wants to change or revoke their representative, whether that be a healthcare surrogate, a power of attorney, or a guardian, they can reach out to us and we can help them either provide education to them on how to do that or walk them through the process, or even refer them to their social services worker in the facility. A family member may contact us and say the resident isn't getting adequate care from staff. They might not be receiving showers as often as they should. Since our program is resident directed, our priority is to contact the resident first and ask them, how do they feel about the situation? Do you feel that your showers aren't occurring often enough? The resident might say, no, I'm getting 1 shower a week and that's really all I need. I take care of the rest of it myself. I don't have a problem. This isn't a concern of mine. Then we don't do anything. But if the resident shares the same concern that's called into our department, then we can help them address it. Sometimes a staff member may contact us with concerns about a family member that's verbally or emotionally abusive to the resident. Again, we wouldn't investigate or do anything unless the resident gives us permission to do that. And just as Adult Protective Services does, we can refer to counseling or therapy services. Sometimes we receive reports from residents that feel like they're being held in the facility against their will. Oftentimes, if a resident is confused, has a cognitive impairment, has dementia, Alzheimer's, or anything like that, they may feel that they can't leave and they're locked in there forever. And we can explain to them that, maybe in certain situations that's for their safety and they're there for their safety. But in other situations where a resident doesn't have to be in a long-term care facility and they might have the option to be living in the community with caregiver services, we can educate them on that and provide information. If a resident is in a facility for short-term rehabilitation for physical therapy, but their insurance isn't paying for their stay anymore, their Medicare isn't covering it or something like that, then we can educate them about their options and their rights. They do have the right to remain in the facility, but they would have to either switch to Medicaid or public aid to cover their stay, or they would have to pay out of pocket for those services. And then if the facility is trying to transfer or discharge a resident against their wishes, and they would have to issue an involuntary discharge notice, formal paperwork, then we can assist the resident in either arguing or appealing that kind of document. We do have a volunteer ombudsman program. As I said, I'm the volunteer ombudsman coordinator for our program. Our volunteers each are assigned to a specific skilled nursing facility, and when there's no COVID, they are going out to those facilities at least once a month and doing the same types of things that we do. We can walk through and talk with the residents, see if they have any concerns or complaints, and generally get a feel for how things are going. And then if they do have any concerns, they can either talk to our hired staff to open up a case for some individual attention, or they can bring the complaint to the facility management, as long as that's okay with the resident. So they're trained and certified just like a hired case manager is, including criminal background and reference checks. And they advocate for resident rights just like we do. They can do education sessions, they can educate residents and staff just like we do. And like I said, they're there for establishing a relationship with the residents and having that that one-on-one at least once a month. Right now, our volunteer program is on hold, but we're going to be starting to get our volunteers more active in our facilities again soon. So volunteers do not open individualized cases like our hired ombudsman staff do. They are just there for that one facility, and if a case needs to be made, then they can make that kind of referral to us. And quickly, I know there's a lot of talk about how COVID-19 has affected our long-term care facilities. Here's a very confusing graph about how our facilities have been affected in Illinois. So you'll see that in the orange, those are the number of residents that have had positive test results in our long-term care. You can see that the blue is staff members. So obviously that was it was spreading like wildfire in the very beginning of the pandemic. It settled down through the summers, got bad over the winter, and once vaccinations started in January, the numbers started to go down drastically. Unfortunately, we are seeing some outbreaks again due to the Delta variant. So those numbers are going up a little bit again, but definitely not as bad as it was in the past. Nationally, the long-term care facility rates for vaccinations vary depending on the region or state, but the number of overall confirmed COVID cases for residents is astronomical, and the number of deaths. So we are seeing an increase in vaccination of residents, and I'm sure you've heard on the news about the new mandate for vaccinated staff members in long-term care facilities. So those numbers are going to be changing too pretty soon. So we all take our direction from the Center for Disease Control, or the CDC. But they're under them as an umbrella of the Center for Medicare and Medicaid Services. They're providing funding to our skilled nursing facilities. And if they give direction on how to handle an outbreak in a facility, then facilities are required to abide by that. The Illinois Department of Public Health also provides additional guidance to them on how to handle that. And as far as ombudsman, how we're taking direction, our state long-term care ombudsman takes direction from those top 3 agencies, and it all whittles down to our regional program and how we're going to handle things. So we did suspend indoor visits to long-term care facilities between March and October of 2020, and we started off slowly by completing virtual or window and outdoor visits. And now we're back into the swing of things. We are there just as often as we were before the pandemic. Reasons to contact us is to either learn more about our program, receive updates of COVID-19 restrictions in facilities, providing information and advocacy and resident right information, whether you want to make a report, or if you want to seek information about the different types of long-term care facilities. If you're searching for a facility for a loved one, our office can provide information about the types of facilities, including a listing of each facility in DuPage County. And again, we have the same contact information as Adult Protective Services. It all goes through the DuPage County Senior Services Department. So the number is the same, and you can call that number to either make an Adult Protective Services report or an ombudsman report, or to receive information about facilities. And I think that's it from me. I tried to fly through because I can get pretty deep in the weeds with things, but if anybody has any questions, I'd be happy to answer them.
Right. Well, thank you so much to both of you. And just a reminder to go ahead and open up your Q&A so that you can enter your questions there. Lindsey, I'm just wondering, I'm guessing that the transition from perhaps someone senior living at home to entering that living facility is a difficult transition. Lots of changes for anybody. And I just imagine that there would be a lot of concerns and complaints and things that they don't like about new surroundings. All of us have that. So I'm just wondering, with your program, how do you discern what's just a difficulty in transitioning and what's something that needs to be investigated further?
It kind of depends on the concern that's brought to us. So anybody's going to have difficulty transitioning from their home in the community to a long-term care facility. Some folks maybe are going through the steps of maybe starting out in a supportive living facility and then moving to an assisted and then a skilled nursing facility when needed. So they kind of have a lesser adjustment, but for residents that may have had a major fall, or they're going straight from the community to a long-term care skilled nursing facility, those adjustments are hard. And it's while we're there as a support and an advocate for these residents, we're reminding them and educating them about their rights and everything, but we're looking into complaints if it's relating to the facility or the staff as a whole. We're going to investigate it regardless of if they're maybe doing it out of fear or anxiety. We're just going to take direction from the resident at that point and see what they want us to do or how they want us to help.
Okay, thank you. Because I imagine if you have been a caregiver and your loved one is entering that kind of facility, it's hard to evaluate exactly what's a transition difficulty and what's a serious concern. So thank you.
Right. It's nice because most facilities will provide our brochure to residents that are first being admitted to their facility. So there's that huge admissions packet and contract and all of that. But they do make sure that they take time to explain what our program does and explain that these residents can reach out to us anytime. And all facilities are required to have ombudsman posters throughout their facility. So residents can see that on a regular basis and know that they can call us if they need help.
Right. And one of the things you mentioned is that you do staff training. What types of things does that entail?
Most of the time, we'll do general trainings about our program, make sure that staff understand what we do and that we're here. We're going over a lot of resident rights, explaining what those resident rights are. And sometimes if there's a specific problem at a facility, for example, there was a facility that had staff accepting additional money or gifts from residents for providing them more care. And that's in the long run, that's financial exploitation. So we had to go out there and explain why it's financial exploitation, why it can't be done. But we'll go out for particular situations as well instead of just general information sometimes.
Great. Okay. All right. Well, thank you both very much. I don't know if there's anything else, maybe typical questions that you get that you want to be sure get answered. Again, since this program is being recorded, we're trying to provide information for posterity here, one-stop shopping to answer questions that might be out there. I don't know if there's something in particular you get asked a lot that you'd like to address while we're here. Or maybe not.
I mean, and I'm sure Regina gets this too, but if I'm out in public or I'm talking to a friend and they ask what I do for a living and I explain what I do, they're like, oh my gosh, I can't believe you do that. That's got to be so difficult. But it's very incredibly rewarding as well. I mean, it is difficult. It is hard some days to see some bad things sometimes, but it's very rewarding. And having a volunteer program, having volunteers be able to come out and do what we do, that's very rewarding for them as well. It's difficult, but it's necessary.
Well, and we are so fortunate to have so many great resources in our community. And again, that's one of the reasons why we want to provide these programs, to make sure that people are aware of these things that are available. So thank you so much to each of you, Lindsey and Regina, and of course to DuPage County Senior Services for putting all of this together for us. We really appreciate all the time and effort that goes into these presentations. We also will be sending out the link so that people can contact you in an email tonight following the presentation. If you're watching the recording of this program at a later date and you would like that link, please just contact me at ce@wheatonlibrary.org. That's CE for community engagement at wheatonlibrary.org, and I'd be happy to send that link out to you. And you can also pause the screen at the end of each of the slideshows. There was additional contact information there as well. So again, thank you to each of you for all the time and effort and for being here tonight. Thank you to each of our attendees. And with that, I will say good night. Everybody take care, and we hope to see you again soon.